Hi, Callie. My name is Amelia Sims Diazzo. I'm one of the on-call workers today. I'm a social worker. One of your doctors wanted me to touch base with you today. They just expressed some concern. Would you mind coming with me and we can have a discussion in my office?
Yeah, that's fine.
Okay, great. How's your day going so far?
All right. Yeah.
Okay. Do you want to have a seat? So basically, the doctor has been a little bit concerned. I know you've been having some ongoing struggles and difficulties with some depression. So we want to just kind of look at what's going on. And also, they were kind of concerned with some of your increased use in drinking. So, want to just do a quick assessment to just see where we can maybe assist you. Is that all right?
That's fine.
Okay. So, one right now, you reported to the doctor you've been drinking a lot more than you normally have been in the past, you know, recently increasing the past month. So I'd like to know, have you ever felt that you should cut down on your drinking or any drug use?
Um, I mean, I guess I've thought about it. I've I've thought about it a little bit.
Now, have you ever had like friends or family kind of, talk to you about your drinking or drug use saying, hey, I think you're kind of overdoing it?
Yeah. My husband's hinted around a few times. It's actually started a few of our fights before, but so yeah.
Okay. So that's been causing some fights. Now, have you ever felt guilty about your drinking or drug use?
Yeah.
Okay. Now, can you tell me if you've ever, first thing in the morning, had like a drink in the morning or any drugs in the morning to kind of wake up?
Um, I mean, I wouldn't necessarily say it was to just wake up, but yeah, I mean, on the weekends I'll start pretty early.
Okay. Have you ever used it at times to kind of avoid like symptoms of like a hangover or any
Oh,
withdrawal symptoms?
oh yeah.
Okay. Okay. So right now, how much do you feel you're drinking on a daily basis?
On a daily basis, I'd say I've had about, mm, I mean, it just depends on the night, but somewhere around 4 to 6 drinks.
Okay. And what do you typically drink?
Um, I mean, that depends on the night too. If it's casual, just have wine or some beer or, you
Okay.
know, but it just depends.
So your usage can definitely vary
Hmm.
with the situation. So as you may know, alcohol is a depressant. And, sometimes when people drink, there's also, it can contribute to that feelings of depression. So next thing I want to talk to you about is, talking about suicide. It's often a difficult subject. And we want to talk about, you know, your experience, like thoughts of suicide in the past, how you're currently feeling, any previous attempts. So, one, have you ever have you ever thought about suicide in the past?
Um, yeah, I'd say I've thought about it.
Okay, and have you ever had an attempt to harm yourself?
Um, no.
Okay, so looking at the frequency of your thoughts, how often have you thought of suicide in the past year?
In the past year, more so than usual or than ever before, I guess.
Okay,
Um,
has it been, one time, more than two?
no. More, I'd say probably about 3 or 4 times.
3 or 4 times. Have you ever had a plan to harm yourself?
Not really. It's usually just when I'm sitting there drinking and I've drank myself that I'm so much I'm stuck in my chair.
Okay. And have you ever had like intent, basically where plans, thoughts aren't actions, but whenever you start having the plans and the intent, going the extra step to harm yourself. Has that ever happened?
No.
Okay. So I want you to rate like how likely you feel you are that you'll ever commit suicide. Never, no chance at all, rather unlikely, likely, or most possibly yes.
Mm, I'd say no chance at all.
No chance at all. Can you tell me like some of your people normally have buffers that would prevent them from ever wanting to complete suicide or even attempting suicide? Um, what are those things that keep you going?
I'd say my family, I have kids and they mean a lot to me.
So it sounds like you're a really good parent that you care about your kids a lot and what they feel and think. Okay,
Yeah.
so and have you ever received any treatment, for suicidal thoughts, like any hospitalizations? Um,
No.
what about any ER visits?
Um, no.
Okay. So one thing I'm going to recommend, we have many counselors on staff, and we also have after-hour crisis lines. And sometimes depression, especially whenever you're feeling kind of low, and if you start drinking and feeling even more depressed, we want you to be able to know you can reach out and have someone to talk to. So we have a crisis line, and they're all counselors. They're there 24 hours a day, 7 days a week. I'm going to give you my card. Um, and I also want to follow up with you by your next doctor's appointment and kind of explore if you want to think about between now and then about decreasing your alcohol use and maybe what things we can do to get to that point, what options could be available. But I want you to know I'm available, 8 to 5 every day. So if you have questions, please call me.
Okay.
All
That's,
right.
thank you.
Uh, Thank you so much. Bye bye.